so to be able to turn her over. I need to be able to be made host, Pastor, so that we can let people in and I can have the control panel.
I just wanted to quickly ask,
Okay, I see it now. Go ahead.
the share button at the bottom of the Zoom, is that how I share? That's going to share the whole.
Yes, that's exactly how you're going to do it. Now you'll be able to do it.
All right.
You see it?
Yeah, you want me to share it right now?
No, no. Well, when after I introduce you. Thank you so much.
Okay.
Good evening, everyone. Good evening. Good evening. We're waiting to 7:15 exactly, and we'll go ahead and start. Good evening. Dr. Denoa, some people they'll be also following on the actual YouTube. Some people join the YouTube because they don't do the Zoom. So it's a lot of people that do the YouTube. So don't worry about it. I'm controlling everything and I report back the statistics.
Mhm.
Okay, to MedStar. I think the hospital Wi-Fi is going in and out, so you see yourself blinking on your
Yeah,
screen.
yeah,
Yeah,
I do see.
that's how it goes. Okay, I'm going to continually let people in. Good evening, everyone. We're going to do a quick prayer. God, we just thank you so much for the opportunity to be able to come before you, God, and get knowledge on cancer prevention. We thank you for this day. We thank you, God, for the speaker. Thank you for all the participants. And we just give you all glory, honor, and praise. And may people be healed as they watch. In Jesus' name, amen. Okay, good evening, everybody. I would like to introduce to you Dr. Denoa. I'm going to let some people in. Oh, okay, I let the last group of people on time in. Dr. Denoa is an internal medicine resident physician at the MedStar Health Georgetown University Hospital Baltimore program. She's passionate about preventive medicine, community health improvement, and promoting health education and awareness. Her clinical interests include chronic disease management and cancer prevention through patient empowerment and lifestyle modification. Let's give a warm, hearty welcome to Dr. Denoa, who works she works long hours, and she took time out of her busy schedule to give us this presentation. Welcome.
Thank you. Thank you so much.
Okay, there you go, Dr. Denoa. You're going to have the floor. You can go ahead and hit your share button.
All right. Thank you so much, Dr. Hilliard, for that warm welcome and introduction. Um, are you able to see my screen
I am. Um,
or no?
yeah, we can if you hit slideshow,
Sure. Yeah, I just wanted to make
yeah,
sure.
we can see it absolutely positively.
All right. Thank you so much. Thank you, everybody, for joining in and giving me the opportunity to present a talk on cancer and some tips to prevent cancer. Um, so first of all, like why this talk matters? Like why do we want to talk about it? Um, so cancer is like the leading cause of death worldwide. And the thing is that many cancers are actually preventable or they can be detected at an early stage, which means that if we are able to detect them at an early stage with proper screenings, then we can actually intervene and prevent the development of full-blown disease. And then having this knowledge that the cancer, which is a deadly disease, actually is preventable. That knowledge is empowerment. Um, and then small changes can actually make a big difference. And those small changes are something that I'll talk about later in my slides, in form of like lifestyle modifications, etc. Those are like small changes and they can actually make a big difference. So what is actually cancer? Um, So cancer, basically, the cells and the tissues which you see, like the skin and the other organs that we have in the body, they are made up of normal cells and normal tissues. And once those cells and tissues become abnormal and they start to grow out of control, they start having like uncontrolled growth, and that's basically cancer. And then it can spread to other parts of the body and eventually can cause death. So there are different types of cancers. The cancers are of different types on a molecular level. And also there are of different types like based on which organ it is arising from. However, many of these different cancers, they share similar risk factors, the risk factors that are in our control. Those risk factors, they are kind of the similar risk factors which are producing different types of cancers in our body. So the most common cancers in men, uh, prostate cancer, and then followed by lung cancer, colorectal cancer. These are like the top three cancers that are like the commonest in United States as well as worldwide. And then women, the breast cancer is the commonest cancer, followed by lung cancer and then colorectal cancer in the United States and then globally, worldwide. And then skin cancer is something which is pretty common in both men and women. And now, what are the risk factors which predispose to these cancers? So first is the non-modifiable risk factors. The risk factors that we cannot modify, we cannot like treat, we cannot prevent, they are just there. Like first is age. With aging, usually the risk of cancer increases. Then genetics. If like we many times we must have heard BRCA mutation running in the family. So those are like genetics, which gets inherited from one generation to the next generation and predisposes to cancer. And then there's family history, again, family history of cancer, which increases the risk of cancer in the next generation. So these are something that is not in our hands. However, there are modifiable risk factors um, that we can modify, that we can intervene upon, we can prevent them. Tobacco use is like very common and is number one in any form, whether it is oral chewing tobacco or whether it's smoking cigarettes. Then unhealthy diet, lack of physical activity, uh, too much alcohol use, and sun exposure, where there is exposure to ultraviolet radiations that really predisposes to skin cancers. And then infections. There are like these viral infections. One is human papillomavirus, the HPV virus. hepatitis B virus, hepatitis C virus, they predispose to cancer. And I'll talk about which cancers they predispose to a little later. So these are the risk factors that predispose to cancer. So the tobacco use and cancer, the tobacco, either chewing or smoking cigarettes, that is like the #1 preventable cause of cancer. It actually predisposes to 12 major types of cancers. Oral cavity cancer, like the cancers of mouth, pharynx, larynx, and then lungs, then go down in the esophagus, stomach, colorectum, pancreas, kidney, bladder, liver cancer, and then myelogenous leukemia, that's a bone marrow cancer. So pretty much like large set of cancers produced by smoking cigarettes or tobacco use. Hence, we in our clinic often, like whenever we talk to the patients about like cigarette smoking or tobacco use, we offer counseling. You can always seek support to quit, and we offer like nicotine patches or gums or lozenges to help wean off smoking. And there are apps available, there are quit lines available, which can help with cessation of tobacco use. Then there are other risk factors. Alcohol use. Alcohol itself, it can produce a large set of cancers as well. Oral cavity, pharynx, laryngeal cancer, esophageal cancer, liver cancer, colorectum, and also breast cancer in females. Usually, in our clinic, we recommend no more than 14 drinks per week for men and no more than 7 drinks per week for women. However, like complete avoidance, if possible, is always the best. And then sun protection. The exposure to ultraviolet radiations, they predispose to skin cancers. There are 3 types of skin cancers. So this ultraviolet radiation, they predispose to all 3 types of skin cancer. So avoiding the midday sun, using a sunscreen or sunblock with SPF of 30 or more, wearing like hats and long sleeves, avoiding the tanning beds, that helps protection against the UV radiations and hence can prevent skin cancers. Now, the diet and exercise. This is like the small changes can make big differences. That's what I was talking about, like eating healthy diet, fruits, vegetables, whole grains, legumes, and limiting the red meat, processed meat, sugary drinks, and fried foods that can help maintain healthy weight. And then physical activity. Usually we recommend 30 to 40 minutes of brisk walk for 5 days a week. But if people can do like cardio in a gym, that's good as well. So maintaining a healthy weight, it especially reduces the risk of colon cancer and kidney cancer. And also it improves the mood, it improves the heart health. And now, apart from the lifestyle modifications, there are certain vaccines that are available that can prevent certain viral infections which predispose to cancer. So first is the HPV vaccine, which is usually administered between the age of 9 to 26. And so HPV vaccine, it prevents basically, in fact, it provides immunity against the HPV virus. So this HPV virus is usually acquired through intercourse, the sexual activity. And that's why the vaccine that's called Gardasil 9, it's recommended within the adolescent age group, that is 9 to 26. And this vaccine prevents cervical cancer, anal cancer, and throat cancers, which could be produced by the HPV virus. However, even after the age of 26, if certain people are at high risk of acquiring the infection, then up to the age of 45, the vaccination can be considered. And then there is hepatitis B vaccine, which is administered during infancy, and that provides immunity against hepatitis B virus infection, which if acquired, if contracted, then it can produce it can eventually lead to chronic hepatitis B and then hence liver cancer later on. Now there are screenings. There are like certain age appropriate cancer screenings that we always do in our clinic. This is something like good to know. So first is the lung cancer screen. So whoever is like within the age group of 50 to 80 and they've had a history of smoking cigarettes for like 20 pack years, and they're currently also smoking, or they quit smoking in last 15 years, that's when we recommend screening for lung cancer with the help of low dose CT scan. The CT scan, that is like imaging of the chest, and then we look for any nodules in the lung. And then once we get that done, the repeat CT scan is usually done after the interval of 1 year, as per the guidelines. And then there is a colorectal. Sorry. Okay. So then there is a colorectal screening. We at an so starting usually at the age of 45, we recommend starting a screen for the colorectal cancer. Whoever is like average risk individual at the age of 45, that's when we start recommending to start getting the colonoscopy done. And then up to the age of 75 is when we really like screen for the colorectal cancer. And usually, like depending on what the results are on the first colonoscopy, the second interval, like the interval of the colonoscopy is decided. It could be after 10 years, it could be after 5 years, it could be recommended after 1 year, depending upon what was found on the first colonoscopy. However, like some people do not prefer the colonoscopy because it's invasive, requires anesthesia, and then it's an invasive procedure. So in our clinic, like we have been recommending Cologuard. If not, if people don't prefer colonoscopy, then they can have Cologuard, which is a kit that can be delivered to your home. And then there are instructions on the kit that you can follow how to collect the stool sample. It's basically a stool test, and it identifies molecular and protein markers. It has molecular and protein markers, and it's a stool test, and all the instructions are there. And then following those instructions, how to seal the stool sample.
Hello.
And how to steal this, so how to seal the stool sample, and then how to deliver, how to ship it, everything is like written on the instructions. So that Cologuard is it's very sensitive test, and has been very effective, something that our patients have been using a lot. Now the breast cancer screen, starting from the age of 40 is when we recommend start getting the mammography, through which we screen for the breast cancer. And usually the mammography is repeated in 2 years, but it could be repeated in 1 year as well, depending on what was found, what was screened on the first mammography. And till the age of 74, we recommend regular mammography every 2 years. Apart from the mammography, we also recommend women to do the self breast exam, like intermittently. It's good to do the self breast exam because you can find some lump or a nodule in your breast. And if you find it, if you around the breast or in your armpit, if you find a nodule, you feel something, always talk to your primary care about it. Then the cervical cancer screening. This is something that we start early at a young age. At the age of 21, we start this pap smears or cytology, and then it's repeated every 3 years till the age of 29. And then from 30 to 65, we do the pap smear plus HPV co-testing. And it's repeated every 5 years after that, from 30 to 65. And this pap smear or HPV co-testing, this can be done in the primary care, or it can be done at gynecology as well. So in our clinic, we have been doing the pap smears in primary care clinic itself, but we can give a referral to gynecology as well for this. And next is an important one, the prostate cancer screening. So there are no like set guidelines, like there's no like specific hard and fast guidelines for the prostate cancer screen. Usually it depends on the age, the risk factors of the patient, and their own preferences. And then we make a shared decision with the patient regarding the prostate cancer screening. If they have symptoms, then that's, and then we consider the risk factors and we see the symptoms, and then we make a shared decision to go ahead with the screen. So usually, as per this NCCN 2025 guidelines, the recent guidelines, at the age of 45, we recommend start screening for average risk men. But somebody who is at high risk, for example, someone who has strong family history, someone who has like genetic mutations running in the family, like BRCA2 or HOXP13, or someone of Afro-American ethnicity, they are a little bit higher risk than average person. Then even at the age of 40, we could consider if they have the symptoms once we talk with them. So we do a blood test, PSA. Commonly, we do that PSA, especially in our clinics, to screen for it. We see the levels. If the levels are less than 1, then we repeat the PSA in 2 to 4 years. If the levels are 1 to 3, that's a slightly higher level. So then we repeat it earlier in 1 to 2 years. And if the levels are more than 3, then it's pretty high level. Then we consider doing further evaluation immediately, maybe considering MRI or the biopsy. So that's about the prostate cancer screening. Now, something very important to know, identifying the early warning signs. So if anybody is having unexplained weight loss, like you did not make any diet changes, you did not start exercising too much, but all of a sudden, like your diet has been same, you've been exercising the same amount, but you're having unexplained weight loss, that is something concerning. If you're having persistent fatigue out of the ordinary, you're noticing some lumps, new lumps on the skin, new lumps on the breast, new masses anywhere in the body, you're having unexplained pain, there is a persistent cough or hoarseness that is not explained by anything else. There's difficulty swallowing. There are changes in bowel habits, bladder habits. There is a rectal bleeding. There's vaginal bleeding. There's iron deficiency anemia. So especially in men who are elderly and they're having iron deficiency anemia, that is kind of a little bit concerning for colorectal cancer. Any sores on the body that are not healing, especially on the skin, that raises concern for skin cancer. Any unusual bleeding or discharge. So these are the warning signs to watch for. For example, like in lung cancer can present like persistent cough, blood in sputum, having shortness of breath. Colorectal cancer presents with this changes in bowel habits, iron deficiency anemia, like I said, elderly men having iron deficiency anemia out of nowhere. That is concerning. Rectal bleeding. Then female breast cancer, having a new lump on the breast, nipple changes, if there is dimpling on the skin around the nipple or on the breast, if there is a nipple discharge just from one breast, and uh, you are not like lactating, you are like 59 or 60, and you're having nipple discharge from just one breast, that is concerning for breast cancer. Now, prostate cancer is, the symptoms are like, you like the patient is, you are forcing yourself to, you're straining yourself to urinate, and then your stream breaks, and then after urinating you're still like retaining urine, and at night during sleep you have to get up multiple times, like 10 times, 13 times at night to go and urinate. Or you're having urgency, there is a sudden urge to urinate, and then before reaching the bathroom you end up wetting your clothes. So that those are concerning for prostate cancer, along with like having family history, having the age, elderly age. Those are like concerning for prostate cancer. And head and neck cancers, like there are non-healing ulcers in the mouth, there's sore throat, hoarseness of voice, which is not explained by anything else. In presence of risk factors like excessive alcohol use or excessive tobacco use or cigarette smoking throughout the life, like maybe 50 pack year smoking history, that raises concerns for head and neck cancer. Similarly, esophageal cancers, there would be difficulty swallowing or painful swallowing. Liver cancer will actually produce abdominal pain and swelling. There would be like bloated, like liver, there would be a fluid collection in your belly. You will have to be like, person will have jaundice, yellow skin. Bladder cancers would have blood in the urine, painful urination, pelvic pain, along with weight loss and the risk factors. And then cervical cancer in females, that will have like intramenstrual bleeding, like between the menses. There is unexplained painless bleeding happening, or pain in the pelvis, which is like around the vaginal area, and there's like abnormal discharge. So that raises concern in presence of risk factors. And the breast cancer I already talked about. The endometrial cancer, that's a uterine cancer, the cancer in the uterus. So postmenopausal women, like elderly women who've had, like for example, who've had menopause for 10 years. Now all of a sudden they start bleeding, or they're having breakthrough bleeding, clots, in the, so that raises concern for the uterus cancer. And then acute myelogenous leukemia, that's a bone marrow cancer. So that would present with fatigue, pale skin, bleeding, small like petechiae on the body, and high risk of infections or getting recurrent infections. That would raise concerns for this acute myelogenous leukemia, along with like the blood work and blood testing indicating towards it. So there are like free screening programs available in Baltimore, in Maryland. There is like this Baltimore City Cancer Program. They provide free breast cancer, cervical cancer, and oral cancer screenings for uninsured individuals. And then there's Women's Cancer Protection Program by the Baltimore County Department of Health. They provide free mammograms and pap testing. Then there's Maryland Breast and Cervical Cancer Program, also provide like free of cost mammograms and pap testing for people. And LifeBridge Health Mammothon, they offer mammograms as well for uninsured or underinsured women. And I'm pretty sure there are other resources as well available, um, free of cost, and free testing and mammograms, etc. And this is the smoking and tobacco or vaping cessation resources. There is this Maryland Tobacco Quit Line, this Baltimore County Tobacco Use Prevention and Cessation Program, and then there's Baltimore City Health Department. They offer education and links to cessation services. Well, in the end, I would like to talk like caring for basically the mental and the spiritual health is like just as important as the physical health and the physical things that we talk about. Like when we think about cancer prevention, or when I was talking about all of that, we focus on physical things like quitting smoking or eating healthy diet and exercising, etc. But mind and spirit are just as important. The chronic stress can actually weaken our immune system, making it harder for our body to fight off illness. So managing stress is important. And the faith, prayer, meditation, and spending time with supportive people, whether that's in church, whether it's with family or in your community, all of that builds resilience and gives the strength to fight, stubborn illnesses like cancer. And they help us cope better with challenges, heal faster, and stay hopeful. Well, that is all I had to uh, say, and I thank you for giving me the opportunity to talk about cancer. Thank you.
I'm sorry. Let's give Dr. Danoa a round of applause. Thank you so much for your time and energy and input into this presentation.
Thank you so much for giving me the
I think
opportunity.
that's the hospital system. Do you have anyone have any questions that they would like to ask at this time? We have a few minutes for questions.
Thank you for enlightening us. It was wonderful.
Thank you.
Last call for questions. Okay, everyone have a blessed night.
Thank
Enjoy
you.
your night. God bless you. Good night.
Good night.
Good night.